a few things I wanted to highlight, but always nice to kind of recap where we've been before and where it looks like we're going. But
right.
you guys, thanks. It was really insightful to hear what they had to say about the vaccine rollout. We're all very, very interested in that, and I certainly can't wait for it to get here. I didn't hear them say if they knew what day it was going to be here yet. Did they say they knew that?
Not really. Yeah, they said by mid to end of the month. So I think we're in that
Okay.
zone now. And they're definitely making the preparations. But I got to thank Annette and Director St. Augustine because it's such a valuable interview and interviews that we've had with them this week. As people are really keen on this vaccine. A lot of people talking about whether or not they're going to take it too, and I think that's a conversation that we haven't really had here yet.
Yeah, and I want to say actually, Dr. Lombard, it was yourself and the epidemiologist, Dr. Pobutsky, who were like among the first people, not just on a show, but like that we've heard of that actually said it's like man, I'm a healthcare practitioner. I admit I'm scared of getting this thing, so sign me up. And you even said like last week, you said I'll be the first one in line when we're ready.
Yeah.
Is your staff
Absolutely.
like completely all on board to receive the vaccine if given the choice?
I'm going to highly encourage it, but a lot of businesses are going to have to decide if they're going to make it mandatory, or if they do make it mandatory. If somebody decides they don't want to take it, are they going to go to the lengths that they're going to actually fire somebody over this? And I'm certainly not going to go that way.
Right.
I'll try to use logic and data and show them why I believe it's a safe vaccine. And I think there's plenty of good reasons why it's the right decision. There are a lot of fears, but I think with the right education strategy and public service announcements, you can kind of break through some of those barriers that people have.
Doc, you talk about plotting the path of where we've been and looking ahead to where we're at, and let's kind of jump into that with PowerPoint Pete over here. So go ahead. Are we doing a screen share, Jay?
Yep.
Okay.
Yeah. So, all right. So, I wanted to show just how far. This is a weekly breakdown. The first slide here shows how many cases we've had over the past week that ends on Friday. This week's numbers are about to come out, and I think we're going to see a drop down to around 120 cases compared to 191 last week, and probably well less than 20 in the age categories over 60 years old. So just a tremendous improvement over the past 4 weeks. And you can see we're down to levels that we haven't seen since early August when our late summer surge first started. So, and that's reflected in the CAR score. It's reflected in our daily cases. It's reflected in our hospitalizations. There's definitely good news there. We had a couple deaths last night reported, so we're up to 115 now. I mentioned this a little bit last week. It's really nice to see we've fallen off the curve of what was predicted, and I really think a lot of that has to do with the fact that we're just not as open in hospitals. When we have fewer sick people to take care of, then I think we do a better job taking care of them. We were the numbers that we were predicting were tracking along for almost 3 months very closely, and then more recently they started to diverge quite a bit, which is a great thing for us because we're looking at 150 COVID deaths. If we had stayed along that same path, if we stayed along that same plateau of cases when we were in the 70 to 80 cases per day, that's how we would look. So really fantastic that things are turning around for us. That doesn't discount the fact, though, that we're still going to have around 250 extra deaths this year than what would be expected for this year if there was no COVID around. So, that suggests there are a lot more deaths out there that are attributed to COVID that we haven't correctly identified.
Yeah, Doc,
we've talked about that a few times.
I wanted to share with you just real quick, and we're trying to confirm this. But I got a message on my social media from a woman who said that her grandmother had passed in mid-November and that she would soon be counted as a COVID fatality. And this woman was saying that she's in a conversation with some of the people at Adeloop. So I know that you've said a lot that we might be undercounting these deaths. So I think that was also interesting that they released a death that happened on, I think, December 7th, right, Bree?
Yeah, I believe it was December 7th.
So I'm kind of curious about I know that's a little anecdotal, but I thought it was interesting that you bring that up. And And so we'll get more info on that. And anyway, go ahead.
Yeah, I think there's when you hear about examples like that, you can understand how these things can happen. They can be missed on the day that the person dies, but eventually it's discovered that they did have COVID, and that was definitely something that contributed to their death. So I think, even if we're at 200 excess deaths, that's a lot, but I think we're looking to be around 250 or so. The vaccine, I talked about this last week, and it's really great. I heard Dr. Cabrera's interview a few days ago, and I was surprised even talking to a nurse at the OR where I operate, and she was a little bit on the fence about taking the vaccine too. So, I try to just reiterate the most important points. We've seen 30,000 people get this mRNA vaccine and no serious adverse events. There is, and I don't think this has been discussed, but I'm sure it will soon. You guys have been asking every time almost, hey, is there anybody that should not get the vaccine? And other than, pregnant women, and I think it's children under the age of 16. But I think what we're going to see is folks that have a history of anaphylactic allergies will probably also not be recommended to have the vaccine. But that's some fairly new information coming out of the UK, because I do think there's an adjuvant within the vaccine that some people can have an allergy to. So, but in general, this is a just tremendously effective vaccine, and so far, the side effects on the profile of side effects are very, very, very favorable. So I wanted to show this, and if you had to be, if somebody asked you to take a medicine and this was the side effect profile, you got fatigue in 33% of people, headaches in 33%, chill 6%, 11% with diarrhea, 11% with muscle pain, 6% with joint pain. Would you be really excited about taking this medicine? Probably not. This is in fact is straight from the Pfizer data, not for the vaccine, but for the placebo arm. These people didn't even get the medicine, and these are the side effects that they reported. And I just think this is really, really interesting to show people, because even if you're given a sugar pill and then they ask you subsequent questions, you don't know if you got a medicine or not, you're going to self-report symptoms that you're having, and they may have nothing to do with the medicine that you actually got. Now, when you look at the vaccine arm, these numbers are a little bit higher. So I think for fatigue and headache, for example, it's like 40%. I think the other one, the muscle pain, was a big one that was a little bit higher, maybe twice that, to 12%. So it's not that there's not going to be any adverse events, but I also want, when people are looking at those adverse events profiles, even for the milder symptoms, some of those symptoms can be attributed to simply the placebo effect. People not sure they're having symptoms, and they're not sure if they need to attribute it to the vaccine or not. I think I showed this last week as well. So if there's 10 million people in the United States, over 2 months, this is how many people will have a heart attack and stroke and cancer diagnosis, and 14,000 people will die. So if you vaccinate that 10 million people, the same number of people are going to have the same number of incidents of these diseases here. And there's going to be people that have the vaccine that die, that get a stroke, they get cancer, and they're going to be scratching their head. So I went through and actually did the calculations for Guam. Over 2 months from a vaccination date, amongst the vaccinated, we can expect about 40 people over 2 months will have a heart attack, 40 people have a stroke, about 9 people have a new cancer diagnosis. About one, a little less, will be diagnosed with MS, and 140 people will die. That's of 100,000 people vaccinated. So you can imagine the barriers and the challenges that we have to try to get the proper messaging out there. And there's going to be some people who get the vaccine and have something happen to them, and they're going to wonder if it was the vaccine that caused it. And until we at least the data to this point in the trial show there is not an increased incidence of these things happening. If they happen, they're probably going to happen anyways. And by the way, we're going to be vaccinating people first that have higher comorbidities, so they're already at a higher risk of having these over these numbers. These numbers are just an extrapolation based on the average risk in the U.S. population. And so I just think this is interesting. I think it's something that people need to be thinking about as they're making the decision to have the vaccine. And once they have it, to just go in there with an open mind, and if they haven't have symptoms after the vaccine, that they are really critically thinking about what's going on, and they're not falsely attributing symptoms. Now, of course, we want to be safe and we don't want to miss anything. Sure, it's certainly possible that there's some very rare things that could be happening out there, but those things should be turning up in with the numbers and the trials that they have. So just a quick shot at where we are with hospitalizations in the pink there. They're dropping down. Unfortunately, we still have 10 people I think in the ICU, and 8 or 9 of those are on ventilators. So unfortunately, we still may be seeing some deaths over the next few weeks. But I think we're down to like 3 deaths in 2 weeks, which is just a huge improvement over where we were before. Right. I've heard a couple. I know I've heard Dr. Guerra mention this. Have you guys heard of the Swiss cheese model? I don't know if you've seen a picture of it, because I think it kind of really shows you all the different layers that go into our defenses against having a major outbreak or a surge. And there's this shared personal responsibilities, and then the shared responsibilities. A lot of the shared responsibilities you're depending on policy, whether it's businesses or government policies. But for people to come out with and say something about masks or about the 3 feet rule and or ventilation or opening schools, it's really complex. It's not a dichotomy of all one or all the other. There's no single method or a single intervention that's gonna stop this. It's a combination of doing the right things together to decrease the chances of enough holes lining up that people end up getting sick. So as we are decreasing in our case volume here, and hopefully we hear some relaxation of our of the PCOR levels. Here's where we were 3 to 4 months ago, worse in the country in terms of new cases per capita. Now we're second to Hawaii, second best in the country. And that's largely due to this massive increase you've seen in the States. And I think you guys heard yesterday, there were over 3,000 deaths in the United States, right, which is just an insane number. And to just have that almost be normalized is just crazy. We've gone through that pain, and now we're at a stage where we say, how do we open up and do it in a way that we're going to be safe? And you look back at the summertime, and you can see right before our peak in August, our surge in August, you can see the mobility data. So baseline mobility is, I overlaid this, and it's right on the 0. You can see our mobility data went from when we first had the first lockdown. You can see it almost get very close to the baseline, and we've been over the past 3 months staying at this 15% less. If they relax some of the restrictions, for sure our mobility is going to go up. So what if it goes back up to the same level that it was here? It was remarkable and actually very lucky, I think, that we went for this 2-month period here where we didn't have a surge, and then enough holes lined up in early August that the cases started to rise. So if our mobility increases, what are the chances enough holes are going to line up again for us to have another surge? And that's the real challenge here. And as I mentioned before, I do think that because we may be close to 30% prevalence, that there's less susceptible people walking around, that even if we do increase our mobility a little bit with some relaxations, I have a hard time imagining we're going to have another surge like this, especially if we go back to what we've been doing in this PCOR 1, PCOR Fun over the last 3 to 4 months. I hear you guys, and I appreciate every time you saying, hey, we still need to be vigilant. This doesn't mean that it's a free for all. We can go back to living like normal, and I think the most people don't truly believe that. But all signs are looking very good as long as we keep doing our job on a personal side. I think we can do things like, for example, I think there's a lot of good data that shows opening up schools, for especially in the younger grade schools, is actually fairly safe. Schools are not a primary driver of the spread of disease of the COVID, and there's more and more data coming out that's showing that's the case. So I think we can explore those things, but it's complicated. When you talk about opening up schools, it's like, opening up schools, and you have to address each one of these issues at the school. How can we do it safely? Because by opening up the school, you're getting more people together. You have to worry about ventilation. You have to worry about kids touching their face and wearing masks. So it becomes more complicated. But I think when it comes to what's primarily driving these surges, it's I think we're finding that it's not schools, and we do have to think about the consequences of keeping kids out of school. And I know there's a lot of people out there talking about that. It's very hard to quantify what the repercussions are going to be for the kids. And, I know a lot of parents are frustrated. They probably feel like their kids are not getting the quality of education that they need. And so as we improve our epidemic profile, I think we need to start thinking about those things a little bit more.
We're just soaking that all in, Doc.
That's some really telling data.
Right.
And,
yeah. Doc, when you talk about thinking that there's not a lot of people left out there to catch COVID, that coupled with just the conversation now, it's kind of shifted towards the vaccine and when we're getting the vaccine and who's going to get it. Do you believe there's any chance that we might not see a surge? Of course, you said that you don't think we'll see a surge like the one that we're kind of coming out of now, but that was a terrible surge, and I think even a surge less serious than the one we just got out of would still be pretty dangerous.
Yeah, and I'm glad you mentioned that. I mean, because even if we're at 30% prevalence, guess what? That's 70% of the population that hasn't had it. And if you want to talk about classic herd immunity, we got to get to 60 to 70%. So we basically have to double the number of people that have had it, which means double the number of deaths that we've had. I mean, if our infection fatality rate is the same, we're going to have another 100, 120 people die if we don't get the vaccine. If we don't get the vaccine, and our numbers, even if we flatten the curve, eventually those numbers will start to go up until we get to that 60 to 70%. So we definitely want to try to continue to keep the curve flat, as cliche as that might sound. At this point, there is, I think you can see the benefits in terms of our deaths and our hospitalizations. When our hospitals are less full, we do a better job of taking care of our sick patients. And so there's absolutely lots of people that still are susceptible. But I think the point I was trying to make is a lot of those people that are still susceptible, those are the ones that are doing the right things and are staying home. The ones that are more likely to be putting themselves out in the public in a situation where they might catch it from somebody else, that's the group where the prevalence is probably a lot higher. And so there's I think that's going to help us control future surges, but certainly it's possible. And that's why we can't, I know they're really focused on vaccine, and that's wonderful, but look back at where we failed, and we didn't have the testing capacity in early August. We didn't have the number of contact tracers that we needed. So if we start having another surge, what have we done to fix those things? They've got a lot on their plate, but I think when it just comes to manpower and whatnot, they're doing the best with what they have.
Yeah, and I think it's interesting now we do have the testing capability, but they're having a hard time getting people to come out and get tested.
Yeah, well, I think there's less disease in the community, so there's less people as worried about it. Oh, I need to get tested because I know so and so is sick. I think that drives a lot of the voluntary testing, and so that just speaks to a lot less disease in the community right now, I think.
All right, Doc. In closing, Jay's got something. Jay.
Oh, go ahead. I mean, if you got a parting shot, Doc, go ahead.
Go ahead, Jay. Go ahead.
No, I'm just. I'll just reiterate. Yeah, I can't wait for the vaccine to get here. Can't get here soon enough. I think that any fears that you might have about the mRNA vaccine, I mean, I think it's healthy to have fears, but again, think about the alternative. Think about if we don't vaccinate and we just let the disease take us to herd immunity, that's twice the number of mortality that we've had to date to get to that point.
Okay, well, yeah, Doc, I just wanted to ask, final question for me, not so much related, but nonetheless important. There's a certain sporting event of which I know you are intimately aware. This Sunday, 6 a.m. right here on KUM-TV on Channel 11. Your alma mater will be playing a game that they take a lot of pride in as a proud graduate of the U.S. Naval Academy. So I don't even need to ask when your beloved
I've got my swag.
There you go. I was gonna ask, are you wearing the ring?
Oh, I don't have it on right now, but I'll be putting on my leather sweater and my football jersey. I'll be all out for Navy.
Well, yeah. Before we let you go, could we get you to just say it one time for all your midshipmen? Just say "Go Navy."
Go Navy, beat Army.
There you go, man. So that's 6 a.m. everybody on KUM TV 11. Army versus Navy will be played. Of course, Dr. Peter Lombard, a 1998 graduate of Annapolis, where, by the way, he graduated valedictorian of his class. Very well done, Doc.
Thanks, Jason. Thanks for having me on.
All right, we appreciate it as
Of
always.
course, Doc. Be
Take care.
safe. All right. Okay.